Hey, how's it going, Elge? Simple Lines Anatomy. Let me just explain what was going on in the last video. I wanted to just kind of clear a few things up because it was a fun video, and also because Clark and Dee Dee made fun of me for trying to be artistic. Sorry for trying to bring a little joy to the world. Anyway, so in the last video, we were talking about how rotation and side bending are paired motion. So if we rotate, there's our rotation right there. If we rotate, it tends to be that side bending occurs in the spine simultaneously. So we say they're coupled. That's the terminology anyway. So if I am rotating, this is rotating to the left. This is considered rotating to the left. Then I should also be side bending at the same time. Now in the neck, that should be side bending to the neck at the same time with that rotation. So that kind of curve. Now you'll see in the thoracic and lumbar spine, thoraco-lumbar spine, we say, that these occur opposite this, or opposite coupling. So they're same coupling, S-A-M-E, and they are opposite lower down, thoracolumbar. So if we rotate to the left in here, we should see side bending to the right. So just to explain, just to make this a little bit clearer of what this opposite and same, because this is just, a bit of a contention for a few people. You will find that, so this is a lumbar vertebrae just from above, clean picture, real simple. It's from our app, by the way, just in case anyone's interested. If you bend to the right, so it's bending down to the right. No one disagrees that that is down on the right, so that's fine. So it's side bending right, S-B, little r. And then if I rotate, it should be in the lumbar spine, it rotates to the left. And so the vertebra goes this way. Now, one way of looking at that is the TVP here. This is the transverse process here. It's coming back at you on the left. That's what you actually feel. That's not how it's named, though. Even though that's what you find, you say it's rotated to the left, you feel the TVP on the left. Should this be a lumbar vertebrae that does that? But the reality is it is based not on the rotation of the transverse process. It's based on the way the vertebra is facing. So if the vertebrae rotates to the left, it rotates like that. And now it's facing like this. SP's back here, TVP, and then another TVP here. Now that vertebrae is actually pointing this direction. And that's how this is actually named. So some people get that a little bit confused sometimes. And just to be very clear on that. And also another thing to be very clear on, it's a small motion that's occurring here. It's not huge. It's pretty tiny, and it's usually, at least at the very first, it's intersegmental. It's between like two vertebrae. So it'd be like between, if this is T12 here, and this is, it's T12, the other one's T11. If this is T11 and T12, you'd name it kind of vertical axis spin, and then you'd have some kind of a rotation here going, that way. So technically we call that to the right. It would be one on top of the other. Now these will eventually form bigger curves, side bending and rotating, which can be as a group, as a whole, but at the very least it can be very small motions, because it's not like when you turn your head in one direction. If you turn your head to the left here, you simultaneously also bend your whole head to the right. That's just not the case. Otherwise, you would always be doing this every time you turn your head. So that's not true. So we have to consider it relative to the joint, though it does form group curves. And this is what we call like a Fryet type 1 and a Fryet type 2 motion. The type 2 being same coupling, the type 1 being opposite coupling. Anyways, so we were talking about if you can't get the head to go to the left. So the head doesn't go to the left. X doesn't want to do it. What you can instead do, because these are paired motions, is you can gain some more motion, perhaps in that rotation that you're lacking, by simply side bending it to the side in this case. So you can actually take that head and sort of trick it. And this is a biomechanics principle. It's not really a treatment principle per se, but if we side bend the head, hopefully it looks nothing like that when you're doing it, but if we side bend the head, you may find that if you get a bit more side bending and it doesn't happen to kick up a spasm or anything, well, guess what? You might be able to rotate it a little bit better. That's what the biomechanical principles are telling us here. If, on the other hand, it's in the lumbar or thoracic spine, if you can't rotate that to the left, if it won't go to the left, then you would try side bending it right instead. So you would do the opposite coupling. So you would try to generate right side bending. And then when you go back and you try and do that left rotation, hey, guess what? It works a little bit better this time around. Maybe, hopefully. It's a nice little effective way of changing the way the body works, tricking it, essentially. It's a trick, that's all, but it's a good trick, and it's very, very effective. But I want to talk a little bit more about why this actually happens. There's a few reasons, and we can look at this biomechanically. So if we're looking at a motion pattern, it's best to look at the anatomy. It's best to look at the shape of the anatomy, because that will essentially answer our questions. So there's reasons for all these things. Now, with the lumbar vertebrae, mostly, let's be clear on this, mostly the movement is going to be occurring at L5, S1. That's where rotation and side bending happens. That's where the higher amounts of that stuff happens. You get a little bit at L4, L5, but L5, S1 is mainly it. In the thoracic spine, we have lots of side bending and rotation. This thing can do all these funny curves through here. However, we're going to be kind of staying clear of being too specific on that. No, it has opposite coupling. No, it works in groups. But because of these ribs, all of these ribs, and because of their connections to the vertebral body, let's not get into anything complex in this particular discussion. So, taking a look at the vertebrae, the facet joints do dictate a fair amount of the motion to an extent, because you'll find that the lumbar spine, for sure, have more of a straight. Now this is more L5, L4, but the lumbar spine certainly has a vertically oriented facet. It's oriented in the sagittal plane, so something like that, and so that means it's going to flex and extend really well. Looking at from a side view, definitely does this, and it definitely can do this. So goes into extension, goes into basically flat. You can sometimes see a flexion occur, but that's usually not a good thing. This is more of a dysfunctional spine, but it should flatten out. That's what we consider flexion. Anyways, so with that, we have to consider other factors. So on L5S1, you'll notice these ones are a tad more angled. They're a little bit more like this. They're in a slightly oblique plane. We're going to come back to that a few times. So it should allow for a bit more smooth rotation. You'll see, guess what? You see the same thing. In fact, the cervical spine here. So flat, kind of like that. There we go. We've got nice flat, and they're on more of a 45. You can see they're more of a flat planar, and so they'll allow for a different level of movement because they are nice and circular, like so. And so when we come to the neck, you'll notice it allows for this kind of swinging motion back and forth. And we call that translation. That's a specialized function of the neck, and it's partially because of these joints of Luschka. But we have side shifting. It's not necessarily side bending. That's where a lot of confusion comes from. But the whole neck shifts to the side. And this is pretty good because it allows for us to turn our head relatively rapidly, maintaining a certain eye line level under a moving body. It's necessary for balance. So even though it seems a bit weird, it's annoying to memorize for testing purposes, but yeah, it's the truth, and it works really, really well for us. It's worked well for probably 2.5 million years, 80 million, I don't know, something like that. Anyways, so these facet joints do allow for some of that. Now, there will also be ligaments, of course. I'm going to, steer clear of that for the most part because they reinforce against excessive motion. So we'll always have ligaments surrounding any particular structure. Let's say we have like the supraspinous, we have interspinous ligaments, intertransverse ligaments, a posterior longitudinal and an anterior longitudinal, and they're going to stop the extreme motions. They'll certainly guide some of the motion because of their fibrous orientation, but not nearly as much as, say, the muscles, which we'll go on to next. We've also got general fascias in the area, too. Those are not to be avoided, and we're not avoiding those on purpose, but the muscles just seem to make a very good example of how this type of motion occurs. So, let's start with just a simple example. And you can make more than this. I'm just going to make an easy one. We have a muscle called the psoas, and it's everybody's favorite muscle in the whole world. And it goes from about TVP vertebral body, transverse process vertebral body, of L1, 2, 3, 4. So give or take this kind of area. And it will come forwards, down, and I'm exaggerating here, but it'll come forwards and down, and it will attach into the lesser trochanter of the femur, which is not seen quite as well in this picture, but it's about there. So it's fibered, and it's a bigger muscle than I've drawn it here. I think I got that more or less right. I hope. Anyways, you can see the angle. Now, it's very important that you understand it does come over this pubic bone here. There's a bit of a bursa there, iliopsoas bursa, combines with the iliacus muscle too. But anyways, let's just focus on the psoas for a minute. So it's coming down. So you can see generally, because it is pivoting around this thing, it generally has the ability on contraction to pull down. Okay, so we got down. That's one motion. But it's more complicated than that because it becomes an oblique motion when you consider that it's also pulling forwards a bit at the same time, because enough of it goes forwards. You can see that maybe better, a little bit better, in the same way in an anterior view. So if we look at it like this, so again, there's that 1, 2, 3, 4. There's 4. And then it comes down, and it doesn't look like this, but it comes down. It kind of looks like that, actually. That's close enough. Comes down, attaches to the lesser trochanter. Lots of fibers. And it, you can see again, generally down, generally sideways too. So we've got both. So again, we could say sideways, pure planar, down. But as a combined motion, get rid of all that, it is there. So that's what we call an oblique line of pull. And it pulls relatively straight due to the fiber orientation. Muscles should. You know, they combine with other muscles, of course. They form groups, and they pull as a unit. But generally, what this will allow for is a combined oblique motion. So that means it doesn't pull straight. So when we talk about the movements of a vertebrae, when we talk about these things, we should never really talk about them happening in one plane because it doesn't make sense. How they will be pulled on is in multiple planes. So in the case of this psoas muscle, because it kind of unifies the lumbar spine, it's going to pull it more as a unit because it chunks this out. And they're, of course, just to understand, they're, of course, connected through those ligaments we mentioned, for instance, the anterior longitudinal again, and the posterior longitudinal, all that. That will unify, basically create a vertical axis for this whole thing to pull around. Now, again, L4 does have some side bending rotation, a lot of this force, and because of the whole weight of the entire body running down like that, you will get unified action, a lumbar spine, in that side bending rotation. So, if you're following me, so if the lumbar spine is being pulled by the psoas, it gets pulled down and this way. So if we look at it as a vertebrae, going back to that lumbar spine, if we imagine this was a little more on the back, if it was pulling on, in this picture, just so we're clear, this picture was the right side psoas. So we're saying this is the right side and this is the left of that lumbar vertebrae. If it was being pulled down, it would bend to the right. And if it was also being pulled forward, like that, so being pulled down on the right, hopefully I got that right, and it's being pulled forward, it would be pulled in this direction, which means ultimately it's now pointing to the left with the body. Again, the body's going to be facing more this way, and so it ends up being that it is side bent to the right and rotated to the left. So the musculature actually does dictate this motion. It shows up there, in addition to the facet joint too. And one interesting thing, just to back this all up, one interesting thing is that Fryet, the same person who discovered this, he didn't create Fryet's motions, by the way, he discovered them, because you can't create anatomy as far as I know. But basically he discovered this, and he got to name it, but he found that when you, say, take away this cadaver, of course, you take away the musculature of the lumbar spine, you go and you dissect all this out, you just go slice it all off. Lumbar spine actually has a high degree of mobility. It's way more than just flexion extension. All of them will side bend and rotate, but you got to take away the muscles. So, you know, that's not most people. You could say that very dysfunctional, very non-functional muscles will give you the same effect. You know, if you are really not firing your muscles properly, they're very weak. They will destabilize the lumbar spine. And you'll see these side bend rotation things come up elsewhere other than L5, L4. But that's a whole other topic anyway. So you can see that the psoas quite naturally does that. And that would, of course, be combined with the motion of the innominate, because you'd have the iliacus in there, too. Oops, wrong color. There we go. Wrong color. There we go. Iliacus. And we could say the same thing about, let's say, the QL. I'm not going to go into great detail, but the QL is pulling also on an oblique, because it's coming all the way from rib 12. It's attaching, again, TVPs, and it's attaching into the iliac area. And so it would be pulling not just straight in any plane. It would be straight into the side. Straight to the side, creating an oblique. Now I'm going to make another couple of examples. We're going to go for the neck. And again, this is a bit specialized. This is different because the neck, remember, has the ability to translate. It doesn't just side bend. It's like everything side shifts. So these two go over here, whereas these two can kind of remain, the lower ones can remain relatively in the same place. Hopefully that makes sense. I say that way too much. Okay. So anyways, let's take the scalenes. Scalenes are really cool muscles, and they follow basically the same rules. I'm going to go for anterior and middle scalenes. They attach to our transverse process. Well, they really attach to, so we can be very specific about this. Oh, look, I have a picture. So they will attach in our general cervical vertebrae here. They will attach to the anterior tubercle of the transverse process, and then you'll have your posterior middle attaching to the posterior tubercle, but that's okay. So anyways, they're going to attach TVP. Let's keep it simple. And they're going to go and then attach to the ribs. And again, you'll notice it's a multi-fibered tissue. And so they'll attach into the ribs. So that's it from the back. So you can see it's going down on an angle. And much like the psoas, it's also going forward. So if the TVPs are right about here, give or take. Throw a few dots in there. I'm going to change the color just for clarity's sake. That's a bad color. There we go. I got it. Okay. And then it goes down into rib 1. It would be going under the clavicle here, but just for, illustration, I have to draw it over top. You get the idea, I hope. So it's going down and around. So that's roughly what a scalene looks like. It's a bad drawing, but just, you get the idea. So it's going down and on an angle. So we get a generally downward pull. So going back to our other picture, we've got down. We can establish that it will pull down because it's angled for that, and it will also pull this way. So we can also say, again, we can say that it's going to summate like that. That will be the end result of that muscle's pull. But at the same time, again, we can look and we can say, okay, we can go with this muscle. It's generally pulling down. It's also pulling forward at it, just this angle of looking. That's all. We're just looking at a different angle. It tells us a slightly different story. So summate that. Boom. Oblique. Oblique. Definitely oblique. So if we're looking at this, I'm going to clean this up for 1 second. So if we're looking at this from behind again, let me get rid of all this stuff. Clarity. Gotta have clarity. It's simple lines anatomy, not complex lines anatomy. Okay. So anyways. So if I was to pull this down, so if it was to pull this down, it would want to create a side bending. It would want to do that if we were anywhere else, but it doesn't do that because what it generally does is translation. Not only that, because it's being pulled down and it's being pulled to the side at the same time, it initiates the translation effect of the cervical spine. So though we will get rotation to, so again, I started wrong. Okay, I got it backwards. All right, we're good. Don't worry. I'm completely sober, I assure you. Anyways, let me get rid of this. Skipped ahead as I always do. Okay, so we can definitely pull forward. Stay focused. Okay, we can definitely pull forward, as you can see. So the angle of the scalene pull will be in this direction. So we all agree that that's forward. So we say it's rotating this way. And even though it's the right side pulling it, you would say that the vertebra ultimately ends up, so it's pulling on the right side. Again, that's the right side. So it's pulling forward there, so it ends up rotating to the left because it's now pointing that way. So when we're looking at it here, it's as if it rotated to the left. However, again, I'll go over these, it's also being pulled down and a little bit sideways. And this is what helps to initiate that translation effect. So the vertebrae will not necessarily, in this case, in the cervical spine, the neck, will not just be going side bending like so, like we see in other places. It will side shift, and depending on where it's coming from, we can see a side shift, just like, say, the top, whereas the bottom parts, let's say that's, seven, there's 7 down there, 7, 6, 5, whereas 4, 3, 2, just up to 2 though, not 1, will side shift. And hopefully it never actually looks like this, because that would be catastrophic failure of the vertebra. Not good in this picture, but this is what it actually looks like. So we get a side shift. So it's here, this angle, and kind of this angle going on. And because it's shorter, it's comparatively, this gets complicated. Stay with me here. Because it gets shorter on this side, these facets will approximate together. We technically call that side bending, even though it's being pulled to the other side. Anywhere else you would see it opposite coupling. Here we see same coupling because of the unique functions of the cervical spine. And so that is how that works. That's why we say in the cervical spine, in the C's, it side bends and rotates to the same side. Exclamation point. You try memorizing that. Seriously, try memorizing that. It's very useful. Anyways, I hope that made sense. A few more examples. We could always make another real good example is, of course, our good friend the SCM, which is about here to there. I'll let you figure all that yourself. Trapezius, to some extent, makes a good example. And then as we get into the neck, semispinalis, splenius also have this obliquity to their fiber orientation. And the obliques actually make a great one, hence the name. Anyways, again, I hope that made sense. I have no idea ever. This has been Elves from Simple Lines Anatomy. We've got the whole social media thing. Check us out, Twitter, Facebook, Instagram. We've also got this app. We've done some real reworking of it recently, and we made a decision recently. We're replacing all the anatomical pictures for the quiz questions. We're just replacing with pictures of cabbages. We think it's a big step in the right direction.